What is Buddhist medicine? What makes medicine Buddhist? What is the relationship between these religious traditions and the practice of medicine, particularly in Tibet? The figure I'm looking at, his name is Khyenrap Norbu. Most of his work was done in the early 20th century. He established the Mensi Kang in Lhasa in 1916. So this is an institution in the capital of Tibet that's hailed as kind of the first push toward the modernization of Tibetan medicine. However, as some works have gone to show, there's not a significant degree of intellectual exchange happening between Tibetan medical and scientific communities, despite the fact that the British were there in 1916 when this was established. So trying to see, what does Khyenrap Norbu have to say about the diagnosis of disease? What are his methods? What does he have to say about pulse diagnosis specifically? How traditionally indebted are his methods? And then how is he innovating? Because he is, but how is he doing that? And the argument I ultimately make is he's deeply embedded within tradition. He's deeply embedded within religion. He's saying the ultimate cause of disease is ignorance, right? It's a very Buddhist sort of phrase. And from that ignorance comes attachment, and from that ultimately come the humors, and ultimately come disease. The processes and the consequences of this Buddhistization, of this Buddhist institutionalization of medicine are the primary questions that I'm asking. Within the four tantras, there are many different ways that we can interpret the channels. Anyways, when a Tibetan physician puts his fingers on the patient's channels at the wrist, they are feeling empirical phenomena, right? They're observing something that's really happening there. But the question that comes in is, how do they interpret it, right? And so this, even within the Tibetan tradition, and this is where we get kind of complicated, even within the Tibetan tradition, there are many different ways to interpret. We could be talking about humors, we could be talking about hot and cold disease. A question that I bring to Khyenrap Norbu's work is not necessarily how is he doing the diagnosis, but how is he interpreting it? So how is he adding to this more traditional narrative about judging the time of death for a patient, and then how is he kind of continuing more traditional lines at the same time?